Hi everyone, my name is Barfin. I'm a doctor of physical therapy and I specialize in oncology and lymphedema rehab. In this video, I'm going to show you some mobility and stretching exercises for frozen shoulder. Frozen shoulder, also known as adhesive capsulitis, is common after breast cancer surgery due to immobility of the affected site because of pain, tightness, scar formation, and protective posture that can ultimately lead to thickening and fibrosis within the joint capsule. There are generally 3 phases with frozen shoulder. The first stage tends to be the most painful one, and this is when patients start realizing they're losing range of motion in the affected shoulder. The second stage is less painful, however, you might still feel stiffness in your shoulder, so it will be most likely still difficult to move and use your arm. And in the last stage, you might realize your range of motion increasing slowly, returning back to normal. Even though this is a condition that tends to resolve on its own, physical therapy and physical therapy exercises are very effective in improving shoulder mobility and reducing your recovery time. Therefore, if you are someone who's diagnosed with frozen shoulder, please reach out to your doctor or your physical therapist so you can start exercising as soon as you can. First, we're going to start with range of motion exercises. For this part, you need a table or a flat surface and a towel. We're going to go ahead and place the towel on the table with our hands shoulder distance apart and elbows straight. We're going to bring our shoulders back and down first, so we're in a good posture. From here, we're going to go ahead and slide our hands forward as far as you can go until you feel a stretch in the affected shoulder. On a 0 to 10 pain scale, with 0 being no pain and 10 being emergency room pain, you don't want to go over 3 when you get to the end range. And we're gonna slowly come back to our starting position. Initially, you can hold it at the end range for 3 to 5 seconds and repeating 2 sets of 10. However, as your pain level goes down, the goal is to be able to hold it longer. So you can increase your time to 10-second holds, 15, 20, and then ultimately 30. At that point, you can do 3 repetitions, 30-second holds each time. The second exercise is very similar, but we're going sideways with this exercise. So we're gonna sit perpendicular to the table with our affected arm on the table, elbow straight and shoulder down. From here, we're gonna go ahead and slide our arm away from us as far as we can go until we feel a stretch in the affected shoulder. Remember not to go over 3 out of 10 pain on the pain scale. We're holding here for 3 to 5 seconds, repeating 2 sets of 10, and slowly come back to starting position. The next exercise is external rotation, so we're working on reaching outward with this exercise. We're going to go ahead and place our affected arm on the table with the elbow bent to 90 degrees and our shoulder by our side. From here, we're going to sit up tall, keeping your spine straight. You don't want to round from your back. We're going to go ahead and bend forward as far as you can go. Once you feel that stretch in the affected arm, we're going to hold this 3 to 5 seconds and then slowly come back to the starting position. Over time, you can increase the holds to 10, 15, 20, and eventually 30 seconds. Next, we're going to work on inward rotation, which is going to help you with reaching behind your back. With the unaffected arm, we're going to hold the towel like this. Bring it lower so you can grab it with your affected side, which is this arm. You can do this seated or standing. From here, using our unaffected arm, we're going to help pull our affected arm up towards the ceiling as far as you can go. Once you get to the end range, hold for 3 to 5 seconds and lower it down slowly. Initially, all you can do might be just this much, which is fine. Just do what you can do, and over time your range will improve and your pain will lessen. With this exercise, we're working on shoulder extension and also stretching our pec muscles. We're gonna go ahead and grab the chair. Grab it from the back if you can. We're gonna brace our core so that way we're not arching our back. From here, we're gonna go ahead and shift our weight forward until you feel a stretch in front of your shoulders. We're gonna hold it for 3 to 5 seconds and slowly come back to your starting position. And make sure the entire time our back is straight. The same thing with this. We can start with 3 to 5 second holds, repeating 20 times, which is 2 sets of 10. And once you can increase it to 10-second holds, we can do 10 repetitions. And when you're able to hold for 30 seconds, you can repeat it 3 times. So these are some of the exercises I initially give to my patients with frozen shoulder. If you're someone who's in later stages, you can also incorporate isometric strengthening shoulder exercises to this routine. But that's it for this video. Please feel free to share it with someone who can benefit from these exercises and the information as well. If you want to learn more about lymphedema and cancer rehab, you can find me on Instagram. And you can also subscribe to our private Cancer Fitness Facebook group. Both of these links can be found in the description below. Thank you so much for watching, and see you in a different video.